What is imposter syndrome as a new nurse, and what can you do to fix it?
Hey pal, you just blowing from Stupid Town?
What's good, you guys? NWA here, Nurse Pat. We dropping some heat. You already know what's up with a fluffy beanie. So something that people mention sometimes as a new nurse or maybe a transition nurse is something called imposter syndrome. So like I said, this is a common thing that happens to not only new grad nurses, but also for new transitioning nurses to different units. Imposter syndrome is basically that mentality that you're not really the responsible nurse for your patients. You're sort of just going with the motions with your preceptor, doing tasks, trying to learn, you know, like as if you're still a student. And then even after orientation, you might still feel that way until you get a little more competent and comfortable. I certainly felt this way when I first started a few years ago as a float pool nurse. I felt like I was just sort of there doing stuff and my preceptor was like the main guy. I would literally tell my patients that I was a new grad nurse and that there was a senior nurse following me and sort of precepting me. And I'll tell this to the patients and even a doctor. I would not recommend doing that, so try not to. And even now, training as an emergency nurse, I sort of feel that way at the moment. I haven't built that confidence yet, but I know it'll come over time. So now that we know what it is, what can we do to sort of mitigate this or fix it, basically? I'd say that it all comes down to a mindset. You literally gotta own that shit. Okay, you are a licensed nurse and you worked hard to get where you're at. You are not gonna know everything, and that's okay. You can still show confidence with how you present yourself, in the way you act, and the words that you use.
Yeah, I guess so, yeah.
You're constantly gonna be asked questions by patients, family members, friends, you know, spouse, whatever, right? Doctors, everybody. You're gonna be asked questions all the time.
Please leave me alone. Leave me alone, please leave me alone.
And it's okay to be like, that's a good question. Let me consult with others and I'll get back to you. Or, let me find out for you. Use your resources. You have your computer, right? You have the patient's chart, and you can look at doctor's notes, impressions and finding notes from like different imaging, from your CT, MRI, x-rays, whatever. And you also have your pharmacist that you could call up. You're not expected to know everything, and honestly, you never will. That's not a reasonable expectation to have. I don't care how smart you are, you know, that's just how it is. Even seasoned nurses, they're learning stuff like damn near every day. Your preceptor will appreciate if you ask questions. If you don't, it scares them. They're gonna find you a little spooky. And not only will you be helping yourself grow, but you'll be advocating for your patients at the same time.
I'm over 72, and I feel great.
I don't give a fuck.
You gotta speak up. One of my best friend's favorite sayings is, closed mouths don't get fed. And I think that's hella true. Nursing is not a profession where you keep your mouth shut. Anyways, don't worry about it too much. Just give it some time. You'll gain that experience, that confidence and competence as you go through with your training. And then over time, you'll get over this little imposter syndrome. And seeing the growth in yourself in your career is always satisfying. I hope this video helps you guys. Let me know, are you experiencing this too? Because, you know, it's okay. It's not embarrassing, it just happens, right? It happens to all of us. I know you'll get over it. If you're feeling the content, be sure to like, comment, subscribe to support your boy. Everyone out there, stay safe, stay humble. I'm out.